We're going to finish off the antiarrhythmic drugs. We've talked about class 1s that inhibit sodium influx into the cell, into the myocardial cell, and class 2, which block the beta receptors on those cells. Um, and I'm going to mention this class 3 again. I mentioned it before very briefly. We don't use these drugs a whole lot. They block the outward potassium channels. This prolongs the refractory time, but it can lead to AV block, and we just don't use these drugs as much. So AV block again is the block between the atrial contraction and the ventricular contraction. And that is not a good thing to have happen. So we don't use these a lot. Sometimes they're used in association with other antiarrhythmic drugs. They are used in particular for a condition in boxers, cardiomyopathy, that just sometimes these drugs help. So sometimes they're associated with that. Sotalol, you might recognize the suffix of that name. Um, if it seems familiar, it is also a beta blocker in low doses. So it has been used for that as well, but we do use the other beta blockers too. And then amiodarone is just another one of these class 3 drugs. So occasionally you'll see these names. That's why I want you to be familiar with them. But we're going to talk a little more about class 4 drugs, calcium channel blockers. So these have pretty limited use in veterinary medicine too, because we have some better drugs that have less side effects to them. But you will see some veterinarians will use these drugs. Verapamil and diltiazem are the ones that we use mostly in veterinary medicine in this class. And they are good for supraventricular tachycardia, atrial fib, atrial flutter, so basically the supraventricular um, arrhythmias. You want to go and categorize these antiarrhythmic drugs according to what they treat, if they treat ventricular arrhythmias or treat arrhythmias that originate above the ventricle, so in the atria, um, otherwise known as supraventricular arrhythmias. So you need to know all those terms and generally which of these classes of drugs treat what sort of arrhythmias. Um, so these drugs will block the calcium channels. Calcium is what's needed for the myocardial cells to contract. Any muscle cells, right? We need calcium in those myofibrils to make the contraction happen. So the thing about them and why they're not used as much is they decrease the strength of contraction and decrease cardiac output. And so I have this AKA here. This AKA is an acronym for also known as, so a drug that decreases the strength of contraction and cardiac output is known as a negative inotrope, negative inotropic drug. So when we have an animal with congestive heart failure, that cannot be the best thing to use. That's why we don't use these as much. Um, so that is the undesirable side effect, but it's also partly why we use them. It will kind of decrease that um, contraction that is causing the arrhythmia. Diltiazem was a drug that used to be used with hypertrophic cardiomyopathy. This was a condition that cats would have. We just don't use it as much because in research it was found to be not as effective. It had been one of those drugs that somebody said, hey, diltiazem seems to help with these cats. And then once we did the research, it came out that, maybe it was the other drugs we were using in association with the diltiazem that were actually helping the kitty cat. This is a cross section through a heart of a cat that had hypertrophic cardiomyopathy. Cardiomyopathy refers to a disease of the muscles of the heart, and then hypertrophic refers to this thickened wall of the left ventricle, in particular in this cat. You can see that this wall is so thick, there's not much room for blood. So that was the problem with this disease is that we just weren't getting much blood out to the body, and it was in this case because of a very muscle bound um, heart. It just could not pump very effectively. So, just wanted you to know those two drugs. They are sometimes used for these supraventricular arrhythmias um, and used to be used for this hypertrophic cardiomyopathy.